And welcome back to Our Health. We are discussing the deadly disease of diabetes. Let's say that I think something's wrong with me, but I'm not sure. Are there symptoms that I will see for diabetes, or how do I know?
There are signs and symptoms. So if you're experiencing frequent urination, if you're very thirsty, if you're feeling very hungry even though you're eating.
But that's most of us, isn't it?
Yeah, that's why sometimes these symptoms go unnoticed. Also, blurry vision is one of them, or tingling in your fingers and your toes, or pain and numbness. Also, if you're type 1, if you are losing weight very quickly, and in type 2, if you're gaining weight, because insulin makes you hungry.
Anything to add to that, Dr. Gonzales?
Yes, I think those are the primary symptoms, but it's also important to notice that there are some people who may not experience any of those symptoms, and then they may be, they may be thinking they're okay and they're not. So that's why it's also very important for them to have at least once a year a checkup and have blood tests done to be able to reassure them that they're doing fine.
But how many of us who might say, yeah, I have some of those symptoms, will actually go to the doctor? You know, we are not, African Americans and Hispanics are not known for running to the doctor, especially men, right away. How do we overcome that barrier?
Actually, you know, HEB, they have a clinic. They do A1C test every second Saturday, and it's only $30. It's a really expensive test, but they'll do it for only $30. Walgreens and CVS, those are all places that we go to frequently, and they even do blood glucose tests free. So I would take advantage of those little opportunities that are in our neighborhoods.
That's a good point. Let's talk, Dr. Gonzales, about trials. You know, we again try to stay away from trials. And oftentimes people have been criticized for intentionally excluding minorities from these trials. Let's talk about the importance, and I think you guys are doing a trial or something.
Yes, we are currently doing a trial. This is one of the biggest trials in diabetes, in type 2 diabetes. And I think it's very important to include the rest of the population, because the United States has a diverse population, and actually our minorities are a huge percentage of that population, so they should be represented in these studies. When you were talking about disparities in access to healthcare and even how we manage certain diseases in minority groups, it is very true. It's because they are not reaching out, or they are not finding ways to become more educated about the diseases or how to treat the diseases. So clinical trials sometimes offer that opportunity to patients, and one of the reasons is because they have really close follow-up, and most of these trials are also free, so the person gets free medications, free care, and follow-up, which is the objective of this. And at the same time, they are contributing, because that's the way we find out how things work or how medications work. That is what we call evidence-based medicine. That's the only way to do it, and that's why we require these huge trials where we incorporate huge numbers of the population, so that we can really know and learn how people respond to the medications, how the disease evolves in these populations, because not everybody presents with the same issues.
What about the responsibility of entities outside of, say, the patient, like the American Diabetes Association? What about putting the onus on them in terms of education, and hospitals in terms of education? What about your organization?
There are, well, I do outreach. That is my job. So I'm always in the community. I do education everywhere. I go to corporations. I go to churches. I have a very big program in the churches, African American churches, where I actually go to them. We do health fairs. We bring medical students in so they can get their glucose tests, and then we bring our literature and information. We do seminars. We have an expo. There's tons of resources, and we also have 1-800-DIABETES that you can call and get information for free. We have a Living with Type 2 program. You get information in the mail for over 12 months totally free, and you can sign up at 1-800-DIABETES or diabetes.org.
That's good.
And I also want to say that sometimes people feel that they cannot access a doctor because of lack of money. And that's a big issue, and I think that's one of the reasons these minorities really don't come to their follow-ups, and they miss their appointments, and they don't take their medications. So definitely, you know, they have to look. So, you know, Harris Health System, we have ways to help people if they come,
need
they
the money.
apply. And then the clinical trial that we're running at Baylor is completely free for people with
Well,
type
that's
2
good to know.
diabetes. And if I can give their number, they can
Go
call
ahead
us.
quickly.
Okay, so please call us. Our number is 713-798-7779. And inquire about diabetes, and if you qualify, you may be able to receive free treatment.
I want to thank you guys so much, and we'll be back after these messages. Stay with us.
Yeah.